Once again, good morning, sir and classmate. I'm Judian Villegas, and together with my groupmates, Ade Luisa Ramos, Angeline S. Tigoy, Nikki Mejia, Ella Cunanan, Kristen Biadan, and Evelyn Ekotanim. We are going to tackle about Health Curriculum Guide. I am a first reporter and I will going to discuss about the conceptual framework. The role of conceptual framework is to make conceptual distinction to organize ideas. Si conceptual framework, when it comes in curriculum guide, ang role niya ay para ma-organize yung mga lesson or mga ideas na naaangkop or sakop doon sa particular na subjects. Like for example, sa health curriculum guides or sa K-12 curriculum guide, when it comes to health, the health education from kindergarten to grade 12 is focuses or it is health education that aims to assist all Filipinos learners about attaining, sustaining, and promoting lifelong health and wellness. Kung mapapansin natin, ang lesson na nakapaloob sa K-12 ay about lifelong or promoting long health and wellness na inaayos ni conceptual framework. Another example is the health education from kindergarten to grade 10. Dito naman nakapokus lang about sa holistic approach na meron tayo like physical, social, emotional, spiritual, or even moral. So sa holistic approach, it means dito lang nakapokus yung lessons. So again, the conceptual framework is use of an analytic tool to make organize some ideas or to organize ideas because health educations emphasize the development of positive attitude, positive health lives, style, or positive skills that relevant in ourselves. So that is the main goal or the rule of conceptual framework to organize para alam natin kung ano ba ang ituturo natin sa mga bata. At si conceptual framework din ay bumabase din sa kakayahan ng mga bata kung ano ang kaya i-attain nito. That's why conceptual framework is really big help to curriculum guide to make it all organized. Now, let's proceed to conceptual framework of the health education. The K-12 health curriculum focuses on the achieving, sustaining, and promoting lifelong wellness. As it was indicated on the inner circle or the center part of the framework, outside of that circle are 9 smaller circles which indicate the topics that needs to be taught in different grade levels in order to achieve the goals. These are the contents area, such as injury prevention, safety, and first aid. That discusses the cause, and on how to prevent the accident and injuries while you are performing various activities at home, school, or in your community. Next is the community and environmental health. So sa content area na ito, dito natin malalaman kung paano ba natin papangalagaan or puprotektahan ng ating community as well as our environment. Also, our self-care. Kung ano bang dapat natin kainin na makakabuti sa atin, ano yung tamang perfect hygiene. Basta dito ang itinuturo kung ano yung tamang dapat gawin na pwedeng makatulong sa ating environment or sa ating community. Third one is consumer health. Ang focus dito ay kung paano ba tayo magiging matalinong mamimili. Since we are talking about health, dapat hindi ka lang bili ng pagkain. Dapat tignan mo rin kung meron kang makukuhang benefits sa pagkain na binili mo for the sake of your health. Next is family health. Of course, it covers information on the human life cycle and also on family dynamics that influence an individual's development of ideals, values, and standard of behavior with regards to sexuality and responsible parenthood. Next is growth and development. So it is focuses on our puberty stage and adolescent na kung saan dapat maging aware tayo sa bawat kilos natin dahil dalagat binata na tayo. Unlike noon, bata tayo, kahit anong itsura natin, ayos lang, di ba? So, yan. And next one is nutrition. So, dapat na-address natin ang importance of eating healthy and establishing good eating habits, especially for children and adolescents as a way to enhance health and prevent diseases. Next is personal health. Dapat na napapractice or ma-improve natin yung mga physical, mental, social, and moral spiritual health para ma-avoid or ma-manage natin yung personal health issues and concern natin. Next is prevention and control of diseases and disorders. It is involves the prevention and control of both communicable and non-communicable diseases and disorders through the development of health habits and practices. And lastly is substance use and abuse. Dito naman nakapokus siya para maging aware tayo sa mga ginagamit natin. Isa sa mga nabanggit dito ay ang drugs. So once na gumamit ka nito at napasobra ka, may mga negative impact ito na may bibigay sa health mo. Basta dito, ina-aware tayo sa mga tao at bagay na ginagamit natin na hindi makakaganda sa ating kalusugan. And that is the 9 content areas. While on the outermost part of the circle, which is consisted of rectangles, those are the things that needs to be considered in teaching the topic. Or we can call a characteristics of the health education, such as holistic, meaning students should not just be developed physically but also mentally, emotionally, socially, morally, and spiritually. And then next, it is also preventive, learner-centered, right-based, and epidemiological, which means that they also discuss the causes and the sources of epidemic and diseases and disorders. Next, it is standard-based and outcomes-based. It is culture responsive, it applies health and life skills. And most importantly is the values-based because to promote an educational philosophy of valuing oneself, other, and environment. They should also consider ethical values as a basis of good educational practice. And that is my report.
Good morning, everyone. I am Ada Luisa Ramos, and I'm from BEd 3E. My report is all about key stage standards and grade level standards. In key stage standards, in kindergarten to grade 3, the learner demonstrates an understanding and observance of healthy habits and practices in achieving wellness. In grade 4 to grade 6, the learner demonstrates an understanding of how changes, which are part of growth and development, impact health practices that help achieve and sustain optimum health and well-being. In grade 7 to grade 10, the learner demonstrates an understanding of key health concepts related to the achievement, sustainability, and the promotion of wellness as it improves the quality of life of the individual, the family, and the larger community. In this key stage standard, we can see that in a different stages, they have a different criteria that they need to attain or they need to attain as a student or as in health curriculum. So makikita natin na different stages sila, makikita natin na iba-iba yung criteria na kailangan nilang ma-attain as a student in health curriculum. So that is the key stage standard. So let's proceed in grade level standards. In grade 1, the learner demonstrates an understanding of the essential concept related to the nutrition and the personal health as well as the knowledge in injury prevention, safety and first aid as factors in facilitating the development of healthy habits and practices among individuals. In grade 2, the learner demonstrates an understanding of personal health, family health, the prevention, and the control of diseases and disorders, as well as injury prevention, safety, and first aid, which are factors that facilitate the development of healthy habits and practices. In grade 3, the learner demonstrate an understanding and knowledge in the following: nutrition, prevention and control of diseases and disorders, consumer health, and community and environmental health factors which help in facilitating the development of healthy habits and practices. In grade 4, the learner demonstrates an understanding of nutrition, prevention and control of diseases and disorders, substance use and abuse, and injury prevention, safety, and first aid, leading to the achievement of optimum health and well-being. In grade 5 to grade 6 or grade 5, first, the learner demonstrate an understanding of the nature of personal health, growth and development, substance use and abuse, and community and environmental health, which helps to achieve optimum health and well-being. In grade 6, the learner demonstrate an understanding of personal health, prevention, and control of diseases and disorders, consumer health and injury prevention, safety, and first aid to achieve optimum health and well-being. In grade 7, the learner demonstrate an understanding of growth development, nutrition, personal health and injury prevention, safety and first aid to achieve, sustain, and promote personal health and wellness. Grade 8, the learner demonstrates understanding of family, health and prevention and control of diseases and disorders, communicable and non-communicable, to achieve, sustain, and promote family health and wellness. In grade 9 to grade 10, the learner demonstrate understanding of community and environmental health, injury prevention, safety and first aid, and prevention of substance use and abuse to achieve, sustain, and promote community health and wellness. In grade 10, the learner demonstrate understanding of consumer health, national and global health trends, issues and concerns, the development of health plan and exploration of careers and how to achieve, sustain, and promote healthy and wellness. In grade level standard, makikita natin na yung grade 1 to grade 4 is parang ang level ng standard nila or yung grade level nila is pinag-aaralan nila yung mga first aid, yung mga injuries, paano gagamutin, ganon. So, grade 5 to grade 10, same, pero mas lumawak lang. I mean, makikita rin naman kasi natin na magmula grade 1 to grade 10 is same lang yung pinag-aaralan. I mean, dadadagdagan lang siya. So, in this grade level standard, makikita natin na yung pinag-aaralan ng bata or yung kailangan ma-attain ng bata, hindi lang pwedeng ma-stuck sa isang topic. I mean, hindi lang pwedeng sa grade 1 pinag-aralan, sa grade 2 hindi na pwedeng pag-aralan kasi napag-aralan ng grade 1. Hindi. So, kailangan, pag tinuro ng grade 1 or tinuro ng teacher sa kanila ng grade 1, ay ng teacher nila in grade 1 when it comes to first aid, ano yung gagawin kapag nagkaroon ng injury, paano gagamutin, ganun. So, kailangan continuous yung studying nila when it comes to health curriculum para yung bata hindi niya nakakalimutan na ganito pala yung kailangan gawin kapag nag-first aid. Kasi 'di ba, alam naman natin na ang mga bata or mga student is kapag napag-aralan na nila ng grade 1 is kalilimutan na nila kapag nag-aral na sila ng grade 2. So dito sa grade level standard, makikita natin na hindi pwede na kapag pinag-aralan sa grade 1, hindi na natin pwedeng pag-aralan ng health curriculum sa grade 2. Parang hindi na pwedeng ma-repeat. Kailangan pa rin nating continuous yung study learning ng isang bata when it comes to health curriculum para tuloy-tuloy yung knowledge niya about sa health. I mean, kung paano natin aalaga yung sarili pag nasa environment tayo, paano natin pangangalagaan yung sarili natin or yung environment natin. I mean, kasi 'di ba pinag-aaral natin yung health curriculum. paano magiging safe yung sarili natin sa community, paano tinalagaan yung sarili natin ng tayo lang, ganun. So, dito sa grade level standard, makikita natin na hindi pwedeng may stagnant yung pinag-aaralan ng bata sa grade 1. Kailangan continue sa pag-aralan ulit. Kung ano pinag-aralan ng grade 1, mapag-aralan ulit ng grade 2 at madagdagan yung knowledge yung when it comes to health para continuous at hindi makalimutan ng bata kung ano yung mga yun at kung ano yung mga dapat gawin when it comes to their health. I mean, kapag nagkaroon ng mga injuries or pinag-uusapan na yung health natin. So, that is my report. And thank you.
Hello, I am Angeline Estigoy and I am going to discuss the Health Content Matrix. The purpose of Health Content Matrix is to identify the program learning outcomes occurring across the courses and experience of program's curriculum. So, dito sa Health Content Matrix ay nakapaloob dito yung unit ng buong quarter na pag-aaralan simula first quarter hanggang fourth quarter ng grade 1 to grade 10. The key to have a good curriculum matrix or map is that it's useful for making decisions about designs of programs curriculum. Design refers to course sequencing, assignment sequencing, and skills and concept development that occurs the program. So, the goal of good design is to develop the program's curriculum in a way that creates the best learning outcomes or experience and thus the greatest likelihood for student to achieve the program's learning outcomes. Dito inilalagay yung mga i-discuss o pag-aaralan ng buong quarter. For both curriculum, design, and the use of assessment findings, the matrix is meant to serve as a catalyst for discussion about the proper sequencing of courses, the degree to which the curriculum really supports student learning, and the extent to which learning outcomes are properly addressed within the curriculum. So, ito yung nilalaman ng Health Content Matrix. Sa grade 1, kapag first quarter, ang pag-aaralan nila ay nutrisyon. Sa second quarter at third quarter naman ay personal health, and sa fourth quarter naman ay injury prevention, safety, and first aid. Sa grade 2, we have in the first quarter is the personal health. Second quarter and third quarter, we have disease prevention and control. Fourth quarter, we have a injury prevention, safety, and first aid. Sa grade 3 naman, we have sa first quarter is yung family health. Sa second quarter, we have a disease prevention and control. Sa third quarter, meron tayong injury prevention, safety, and first aid. Sa fourth quarter, we have a consumer health. So, grade 4 naman, sa first quarter, meron tayong nutrition. Sa second quarter, meron tayong injury, prevention, safety, and first aid. Sa third quarter naman, meron tayong substance use and abuse. Sa fourth quarter, ganun din ulit, substance use and abuse. Grade 5, we have a growth and development in the first quarter. Second quarter, accident prevention, safety, and first aid. Sa third quarter naman, we have a substance use and abuse. Sa fourth quarter, we have a community and environmental health. Sa grade 6, sa first quarter, meron tayong personal health at gayon din sa second quarter, personal health din. At sa third quarter, disease prevention and control. Sa fourth quarter, meron tayong consumer health. Sa grade 6, sa first quarter, meron tayong personal health. Same lang sa may second quarter, personal health din yung tatalakayin. Sa third quarter naman, meron tayong disease prevention and control. Fourth quarter, we have a consumer health. So, for grade 7, we have a growth and development sa may first quarter. And sa second quarter, meron tayong nutrition. Sa third quarter, meron tayong disease prevention and control. Sa fourth quarter, meron tayong community and environmental health. Sa grade 8, sa first quarter, meron tayong family health. Sa second quarter, meron naman tayong disease prevention and control. Sa third quarter, meron naman tayong personal health. And fourth quarter, meron tayong injury prevention, safety, and first aid. And sa grade 9, ang pag-aaralan ng first quarter ay injury prevention, safety, and first aid. Sa second quarter, we have a substance use and abuse. Third quarter, we have a consumer health. Fourth quarter ay consumer health ulit ang tatalakayin. Sa grade 10 naman, sa first quarter ay injury prevention, safety, and first aid. Sa second quarter ay family health. Third quarter ay health trends, issues, and concerns. Sa fourth quarter ay planning for health and for a career. So, ayun yung nilalaman ng health content matrix table, which is yan yung pag-aaralan simula first quarter hanggang fourth quarter ng grade 1 to grade 10.
Good day, everyone. I am Ella Elaine A. Cunanan from BEd 3E. Now, let us proceed to the content standard, performance standard, and their learning competencies from grades 1 to 10, first to fourth quarter. So, for grade 1, first quarter, under dito yung nutrition. Ito yung content niya. So, ito yung mga eating regular meals, especially breakfast, drinking water and milk regularly, eating fruits and vegetables, pag-iwas sa mga soft drinks, and not only that, pati ang behavior during mealtime, kasama dito. Under content standards, yun nga yung understands the importance of good eating habits. Next is under sa performance standards, dito naman yung it practices healthful eating habits daily. Next is, sa learning competencies niya or yung goal nito ay ang pag-practice ng good eating habits kung saan matutulungan ka maging malusog at kumain sa tamang oras at iba pa. Sa grade 1, personal health habits and hygiene, sa second quarter, ano nga ba ang mga ito? Ito yung mga paghugas ng kamay at paa, pagpunas ng mukha at kamay na may malinis na panyo o tuwalya, pag-cover tuwing uubo o mag-sneeze ka at marami pang iba. Sa content standards naman niya, ito yung it demonstrates understanding of the proper ways of taking care of one's health. Then sa performance standards naman niya, ito yung the learner practices good health habits and hygiene. Sa learning competencies naman niya, ito yung it demonstrates proper hand washing. So, pag sinabing it demonstrates proper hand washing, ito yung naghuhugas ka ng kamay before and after eating. Pag madumi ang kamay o kaya kapag kung saan-saan mo inihawak ang kamay, at pag natapos kang gumamit ng toilet, yon, kailangan mo mapanatili na malinis ang kamay mo. Next is, yung sa grade 1 personal health, under health habits and hygiene sa third quarter, dito naman yung tamang pag-alaga sa mata, tenga, ilong, ngipin, buhok, sa balat at iba pa. Under content standards nito, it demonstrates understanding of the proper ways of taking care of the sense organs. Then, sa performance standards, ito yung the learners practices good health habits and hygiene for the sense organs. Ano nga ba ang goal nito o ang learning competency nito? It displays self-management skills in caring for the sense organs. Next is yung demonstrate proper ways of caring for the sense organs like eyes, ears, nose, mouth, and etc. At ang isa pa ay ang pag-practice ng pag-toothbrush o pag-floss sa teeth. So, next is yung sa grade 1, safety and first aid sa fourth quarter. Knowing personal information and how to ask help. Preventing childhood injuries such as safety rules at home, safety rules in school, tulad ng sa fire at mga disaster drills, first aid sa mga maliliit na sugat, yung mga yon yung sa content ng sa fourth quarter ng grade 1. Sa content standards nito, sabi dito, it demonstrates understanding of safe and responsible behavior to lessen risk and prevent injuries in day-to-day living. Next is, yung sa performance standard nito, ay it demonstrates safety behaviors in daily activities. At ang learning competencies nito ay the learner gives personal information such as name and address, identifies appropriate person to ask for assistance, practices first aid for small wounds by washing with soap and water. Next is yung sa grade 2 personal health first quarter. Dito naman yung respect for the feelings of others, yung mga similarities and differences. Then yung sa content standards naman, it demonstrates understanding of the importance of respecting differences and managing feelings. Yung sa performance standards naman nito, the learner demonstrates respect for individual differences and managing feelings in helpful ways. Sa learning competencies naman nito ay yung pag-accept ng pagkakaiba at pagkakapareho, pag-adapt ng makabagong environment at ang pagrerespeto sa iba. Next is yung sa grade 2, disease prevention and control under second quarter. So dito naman ang content nito is yung sa germs and illness. Another one is the disease and their effects on growth and development. So, ayun nga, pinag-uusapan dito yung mga dumi at sakit, pati na rin ang mga effects nito sa ating pangangatawan. Ang content standards naman nito ay it demonstrates understanding of the importance of disease, prevention and control, at ang performance standards naman nito ay the learner applies self-management skills to prevent and control the spread of diseases. Under its learning competency, it explains the relationship between germs and illness, recognizes that illness can affect a child's growth and development, at iba pa. Next is yung sa grade 2, disease prevention and control. Under siya sa third quarter. Sa content na naka-under dito yung prevention and control of diseases due to contaminated food or water. Another one is the prevention and control of diseases due to parasites. Sa content standards naman nito ay it demonstrates understanding of the importance of disease prevention and control. Sa performance standards naman nito ay yung the learners will consistently apply skills to prevent and control the spread of diseases. Yung sa learning competency naman nito ay yung practices personal hygiene and cleanliness of the surroundings to prevent and control parasitic infections. Another is to practice good health habits to prevent foodborne diseases. Next is yung sa grade 2 safety and first aid sa fourth quarter naman. Under its content, andito yung home safety and school safety. So, it means sa home safety, andito yung mga hazards sa bahay. At safety rules, same with sa school safety. Sa content standards naman nito, it demonstrates understanding of rules to ensure safety at home and in school. Sa performance standards, it demonstrates consistency in following safety rules at home and in school. Under its learning competency, identifies home hazards such as household products that are harmful if touched, ingested, or inhaled, and especially the electrical appliances. Isa pa dito is yung pagkilala sa mga warning labels, pag-practice ng safety rules both in school and at home, at marami pang iba. Next is yung sa grade 3 family health first quarter. Under sa content is yung changes in family structure, sharing of responsibility in caring for the sick and elderly in the family, at coping skills for managing changes in family structure. Sa content standards naman nito, it demonstrates understanding of changes in the family and the importance of sharing responsibilities in caring for the sick and elderly family member. Sa performance standard naman, demonstrate skills in coping with changes in the family when the situation arises. Sa learning competency naman nito, it describes changing situation in the family that one needs to cope with. Demonstrate responsibility in caring for the sick and elderly member of the family. Next is yung sa grade 3, disease prevention and control. Under ito ng second quarter. Ang content nito ay yung prevention and control of some communicable diseases. Under its content standard naman, consistently applies the skills to prevent and control the spread of diseases. Sa learning competency nito ay it explains basic information on some communicable diseases like common colds, influenza, and etc. Another is explains the importance of practicing safety measures during certain weather conditions to prevent colds, coughs, and other common upper respiratory diseases. Next is yung sa grade 3, Safety and First Aid third quarter. Ang content naman po nito ay yung sa road safety, like yung principles nito, yung sa pedestrian safety and traffic rules and regulation. Sa content standards naman nito, it demonstrates understanding of safe pedestrian behaviors. Yung sa performance standards naman, it demonstrates consistency in practicing safe pedestrian behaviors. At ang goal naman dito o ang learning competency is analyzes the importance of traffic rules and regulations, explains basic road safety principles, and many more. So, sa grade 3, consumer health, sa 4th quarter naman, sa content, andito yung analyzing health information, factors that affect choice of health products, at iba pa. Sa content standard naman, it demonstrates understanding of factors that affect the choice of health information and products. Next is yung sa performance standards, it demonstrates critical thinking skills as a wise consumer. At sa learning competency naman ito, evaluates health information based on its source of its reliable adult, government agency, media, internet, advertisements, and etc.
Good day everyone, I'm Nikki Mea and I'm going to report the Health Curriculum Guide for Grade 4 and Grade 6. First, let us proceed to the Grade 4 first quarter, which is the nutrition. The foods is any nutritious substance that people or animals eat or drink or that plants absorb in order to maintain life and growth. Many foods contribute to the development of healthy muscles and skin. The most important thing for students to remember is that a variety of good food is necessary. Good foods are those that are fresh or relatively unrefined. Foods with a high amount of sugar, fat, refined white flour, or chemicals are generally not good for us. Foods such as sodas, candies, chips, and other packaged snack foods have high concentrations of sugar and fat with little nutritional value. Foods that are good for development of your muscles and skin include fresh vegetables, fresh fruits, whole grains, which are the brown rice, oatmeal, millet, and etc. Meat, which are the chicken, fish, beef, pork. Dairy, which are the milk, cheese, and yogurt. And eggs, nuts, and seeds, and lastly, the beans. The most important thing to remember is that we need all these foods. A variety of foods will supply the vitamins and minerals a growing body needs in order to develop strong muscles and healthy skin. Foods are made up of nutrients that the body needs to grow and function. There are 3 primary nutrients found in food, which are the carbohydrates, fats, and proteins. Carbohydrates and fats supply energy. Protein supplies energy but also supplies the building blocks necessary for growth and repair of muscles and skin. The body needs the 3 primary nutrients found in the food, which are the carbohydrates, fats, and protein, in order to function properly. The first primary energy of food is the carbohydrates. Carbohydrates are the primary energy source for the human body. They work together with fats and proteins to supply the body with appropriate nutrition. Carbohydrates are made up of sugar and fiber. Foods such as fruit are high in sugar. Whole grains such as oatmeal are high in fiber. Fruits and whole grains also contain many vitamins and minerals that we need to maintain healthy bodies. Some foods such as milk contain a balance of carbohydrates, fats, and protein. Although our bodies needs carbohydrates, eating an excess of refined sugar can cause the body to store extra fat and leads to disease such as type 2 diabetes. Snack Foods such as candy, sodas, and cookies contain a high percentage of refined sugar with little beneficial fiber. All sugar gets converted to glucose for the body to use. Some natural sugars are those found in fruit, in milk, and honey, made by the bees. Refined sugar made from sugar cane and sugar beets has caloric energy but no nutritive value. Refined sugar, when taken into the body, does not go through the normal digestive process since it is similar to our own internally processed glucose. It is freely absorbed into the bloodstream. This interferes with the body's normal metabolism and hormonal balance. The body experiences an initial sugar rush, quickly followed by a precipitous drop, which in turn triggers an overstimulation of adrenals and pancreas. Natural sugars, however, do go through the normal digestive process and are metabolized more appropriately by the body, thus avoiding the high and low swings precipitated by refined sugar. Next is fats. Fats are also an energy source for the body. The body becomes fat by eating foods that contain fat and also by converting sugar into fat. Fats are contained in foods such as nuts and seeds, as well as some fruits and vegetables. Fats are also present in many high-protein foods such as milk and meat. The body stores fat as a reserve energy supply and uses it to cushion the organs. Next is the proteins. The proteins are the primary nutrient for building muscles and skin, as well as the hair, the nails, and the internal organs. People need an appropriate balance of protein, carbohydrates, and fat in the diet to create and repair tissue. Too much protein is detrimental to health as too little. Protein is found in meat, fish, poultry, eggs, and milk. It is also present in vegetables and legumes. Many traditional diets contain complete vegetarian sources of protein, such as the combination of beans and rice, beans and corns, or combination of nuts, seeds, and whole grains. Next, let us proceed to the food plate of every Filipino, the Go, Glow, and Grow foods. The Go foods contain the grains group food that provide the body with energy. It is the first group on my plate and had foundation of a healthy diet. Children learn that Go foods help me run, jump, and play all day. Grains means go. The next is the Glow foods. The Glow foods contain the vegetables and the fruits, group foods that supply the body with vitamins and minerals to keep the body healthy and functioning properly. The children learn that Glow foods means make my hair shine and eyes sparkle. Next is the Grow foods. The Grow foods contain the milk and the meat and beans group foods that help the body grow and develop strong bones and muscles. Children learn that Grow foods help me grow bigger and stronger. Next is the food pyramid. The Philippines uses the Daily Nutritional Guide pyramid and has developed pyramids for different population groups. The pyramid is divided into levels of recommended consumption. Messages about exercise and personal and environmental hygiene serve as support messages for the pyramid. The health food plate for Filipinos, adults, or the Pinggang Pinoy completes the messages of the pyramid by showing the adequate distribution of nutritious foods in a meal. The messages are the eat a variety of foods every day to get the nutrients needed by the body. Breastfeed infants inclusively from birth up to 6 months, then give appropriate complementary foods while continuing breastfeeding for 2 years and beyond for optimum growth and development. Eat more vegetables and fruits every day to get the essential vitamins, minerals, and fiber for regulation of body process. Consume fish, lean meat, poultry, eggs, dried beans or nuts daily for growth and repair of body tissues. Then consume milk products, and other calcium-rich foods such as small fish and shellfish every day for healthy bones and teeth. Consume safe foods and water to prevent diarrhea and other food and waterborne diseases. Use iodized salt to prevent iodine deficiency disorders. Limit intake of salty, fried, fatty, and sugar-rich foods to prevent cardiovascular diseases. Then attain normal body weight through proper diet and moderate physical activity to maintain good health and help prevent obesity. Lastly, be physical active, make healthy food choices, manage stress, avoid alcoholic beverage, and do not smoke to help prevent lifestyle-related non-communicable diseases. Next is for the grade 4 second quarter, which is the safety and first aid. Safety is state in which hazards and conditions leading to physical, psychological, or material harm are controlled in order to preserve the health and well-being of individuals and the community. It is an essential resource for everyday life, needed by individuals and communities to realize their aspirations. Safety. We have already learned about the nature of accidents. Accidents are the mishaps that can happen anywhere and at any time, although we cannot totally prevent accidents from happening. We can take various safety measures to prevent the risk of accidents. Let's learn some safety measures to prevent the chances of accidents. First, we should not play with electrical appliances and electricity wires. Using wet hands to switch on or off any electrical appliances may also increase the chances of electric shock. Second, we should not fly kites from rooftops. Third, we should always avoid playing with fire. Next, we should always follow traffic rules. Disobeying traffic rules is dangerous for both to pedestrians and vehicle drivers. We should not go to the swimming pools, lakes, or rivers without adult supervision. Lastly, we should not play around the construction areas. Construction areas like bridge construction, building construction, and etc. are always prone to accidents. Now, let us proceed to the first aid. First aid is an emergency care or treatment given to an ill or injured person before regular medical aid can be obtained. First aid means help. First aid is the immediate help or assistance given to a person suffering from sudden illness or injury. First aid is given in order to prevent the victim's condition from worsening and to save the victim's life in the most extreme cases. Medical experts are those persons who have good knowledge and practice in treating an injury or a sickness. We are not surrounded by medical experts all the time, so it is necessary for us to have a basic knowledge on helping a victim until he or she is able to get to hospital. First aid is provided in case of some common and minor injuries. We usually provide first aid against bleeding, drowning, burning, fractures, and bone dislocation. Next is the natural disaster. In the event of a natural disaster, having a preparedness plan can be a critical element in helping secure a safe transition out of danger for you, your loved ones, and your property. Preparation is key, but it is also important to stay calm and focused during an emergency. If you are ordered to evacuate, do so. If you are not evacuating, use your time wisely to make preparations. We have 8 tips to be prepared to the disaster or the natural disaster. First is to communicate where you will be. Contact someone outside the affected area to tell them where you will be for the duration of the event. Business owners should remind employees of their roles in helping to get the business back up and running, and how they will be notified when the facility is open again. Second, know the warning signal or signs and alert signals for your area. Stay tuned to your local television or radio station or community alert system for emergency information. Third, we have check your emergency survival kit. Make sure your emergency survival kit is stacked with essential items and kept in an easily accessible location. Fourth, collect emergency building materials. Depending on the type of disaster, you may want to have emergency materials on hand, such as plywood, sandbags, and waterproof tarps. Fifth, fuel up your vehicles and equipment. If you have emergency generator, make sure you have fresh fuel on hand. Depending on your situation, you may need a supply of extra fuel. If so, be sure to store the spare fuel in an approved container in a safe location. Never use a generator inside or even in a garage. Make sure it is located a safe distance from windows, doors, and vents. 6. Be sure you have car chargers for your cell phone, smartphone, and other portable devices. Having car chargers available can assist you in staying in communication with others if your electricity goes out. Do not forget to fully charge devices before a storm. 7th, secure all outdoor objects or move them inside. Grills, spatial furniture, and flower pots are common household items that can become airborne in high winds. Do not use grills inside or store propane tanks inside the house or garage. Business owners should also remember to secure outdoor signage, benches, and equipment to help minimize potential damage. And lastly, the 8th, the know how to shut off all utilities. It is always a good idea to know how to turn off the gas, electricity, and water in your home or place of business. If you need to evacuate suddenly, it may be prudent to turn off utilities before leaving. Before doing so, consider equipment that can help minimize damages and should therefore not have utilities interrupted, such as electricity to sump pumps, or fire protection equipment. You can use these tips to be prepared for the natural disaster. Next is how to stay in safe during a disaster. No one expects to be caught in a potential dangerous and extreme situation such as a natural disaster. If the unthinkable does occur, having a plan and knowing what to do could make all the difference for you and your loved ones. These are the 4 tips can help you to stay safe during a disaster. First, if you have not been ordered to evacuate, stay in safe area or shelter during a natural disaster. In your home, a safe area may be a ground floor interior room, closet or bathroom, Be sure you have access to your survival kit in case you are in an emergency event that lasts several days. Second, listen to your portable radio for important updates and instructions from local authorities. Remember to have a battery-powered radio in your survival kit. Some radios are now equipped with multiple power sources such as batteries, solar panels, and a high crank. Third, if power is lost, use a generator with caution. Make sure conditions are safe before operating a portable the generator. Only operate it outside, away from windows, doors, or vents. Follow all manufacturer instructions. So, dito yung mga matatanda yung kailangan ng generator. The last one is to stay in your safe area and do not drive until the danger has passed. Resist the temptation to check on your property until you are sure it is safe to do so. So, ito din ay para sa mga magulang, parents, or older na sabihan sila na huwag muna mag-drive until the danger has passed. Now is tapos na yung disaster. So, ano yung gagawin natin after the disaster or the natural disaster? These are the general instructions that apply to many emergencies, but not every situation is the same. These tips can also apply during an emergency. First, we need to try to stay calm. Check yourself and others for injuries. Give first aid to people who are injured or trapped. Take care of life-threatening situation first. Get help if necessary. Check on neighbors, especially the elderly or people with disabilities. Confine or secure pets. Use the battery-operated radio from your emergency kit to listen for information and instructions. Do not use the telephone except to report a life-threatening injury. Please leave the lines free for official use. Next, if possible, put on sturdy shoes and protective clothing to prevent injury from debris, especially for broken glass. Next one, if you are inside, check the building for structural damage. If you suspect it is unsafe, leave and do not re-enter. So, huwag tayong paligoy-ligoy sa labas. Next one, do not turn on light switches or light matches until you are sure that there aren't any gas leaks or flammable liquids spilled. Use a flashlight to check utilities. And lastly, do not shut off utilities unless they are damaged. Leaking, a gas leak, smells like a rotten eggs, or if there is a fire. If you turn the gas off, don't turn it on again. That must be done by the qualified technician. This is the tips that we need to do before, during, and after the disaster. Next is the grade 4, third quarter, the substance use and abuse. The drug misuse, abuse, and addiction are all serious public health challenges. Since all of these deal with the use of illegal drugs and inappropriate use of legal drugs, for example, the tobacco, alcohol, prescription, and medication. A lot of people commonly use these terms interchangeably. However, the intervention for each issue greatly vary. That's why correctly identifying a person's drug problem is crucial. So, what is the drug misuse? The drug misuse is generally associated with prescription medicines. Prescription medicines are meant to be taken as directed by doctors. This is because these types of drugs can cause adverse side effects if directions are not allowed. Drug misuse happens when these substances are taken for a purpose that is not consistent with legal or medical guidelines. Examples of these include the the incorrect dose, taking the drug at the wrong time, forgetting to take a dose, stopping the use of a drug too soon, taking a drug for reasons other than why they were prescribed, and taking a drug that was not prescribed to you. Next, what is drug abuse? Drug abuse happens when drugs, including alcohol, illicit drugs, or any psychoactive substances, are misused to get high or inflict self-harm. It is also known as substance use disorder, or the SUD, since people who abuse drugs experience significantly alert thinking behavior, and body function. Next, what is the drug addiction? Drug addiction, also known as severe SUD, is a brain disorder that manifests as the uncontrollable use of substance despite its consequences. People with drug addiction have a physical and psychological need to take a substance because they are suffering intense or debilitating withdrawal symptoms when they go out without that substance. How is drug misuse different from drug abuse? The key difference between a person who misuses drugs and a person who abuses drugs is their intent. The former takes a drug to treat a specific ailment, whereas the latter uses a drug to elicit certain feelings. An example of drug misuse is when a person who can fall asleep after taking a single sleeping pill takes another pill an hour later, hoping that it will do the job. However, it is drug abuse when a person consumes sleeping pills to manage their moods or acquire a buzz, or in worst case scenarios, to commit suicide. Next topic is the prescription versus non-prescription medicine. Over-the-counter medicine, also known as OTC or non-prescription medicine, refers to a medicine that you can buy without a prescription. It is the U.S. Food and Drug Administration FDA that determines whether the medicines are prescription or non-prescription. The term prescription refers to medicines that are safe and effective when used under a doctor's care, where the non-prescription or the OTC drugs are medicines that FDA determines are safe and effective for use without a doctor prescription. OTC medicine consists mainly of vitamins, minerals, herbs, supplements, and certain medication that are safe and effective when patients follow the direction on the label or those given to them by their healthcare professional. OTCs are used to treat an expanding range of conditions, whether these are considered illness or deficiencies. OTCs often do more than just relieve pains and itches. Some can prevent diseases like tooth decay, cure diseases like athlete foot, and help manage recurring conditions like vaginal yeast infection or migraines. The next topic or the content for the grade 3 ay third quarter for grade 4 is the caffeine. The caffeine is a natural chemical with stimulant effects. It is found in coffee, tea, cola, cocoa, guarana, yerba mate, and over 60 other products. Caffeine works by stimulating the central nervous system, heart muscles, and the centers that control blood pressure. Caffeine can raise blood pressure but might not have this effect in people who use it all the time. Caffeine can also act like a water pill that increases urine flow. People most commonly use caffeine for mental alertness, headache, migraine, athletic performance, memory, and obesity. It is also for asthma, gallbladder disease, ADHD, low blood pressure, depression, and many other conditions, but there is no good scientific evidence to support most of these other uses. Caffeine products sold in very concentrated or pure forms are a health concern. People can easily take doses that are much too high by mistake. The caffeine is effective for migraine. Taking caffeine by mouth together with the pain relievers such as aspirin and acetaminophen is effective for treating migraines. Caffeine is an FDA-approved product that used with pain relievers for treating migraine headaches. Second, pause in breathing that may be followed by low heart rate and low oxygen levels in newborns. Giving caffeine by mouth or by IV can improve breathing in very premature infants. Caffeine citrate is approved as an prescription drug for this condition. IV products can only be given by a healthcare provider. Next, headache after surgery. Taking caffeine by mouth or by IV is effective for preventing headaches following surgery. Caffeine is an FDA-approved product for this use in people who regularly consume caffeine. IV products can only be given by a healthcare provider. The last one, tension headache. Taking caffeine by mouth in combination with pain relievers is effective for treating tension headaches. It is FDA approved for this use. Next is possible ineffective for the caffeine. The irregular heartbeat or the atrial fibrillation. Taking caffeine by mouth does not reduce the risk for this type of irregular heart rhythm followed by the heart surgery. Second, the attention deficit hyperactivity disorder or the ADHD. Taking caffeine by mouth doesn't reduce ADHD symptom in children. There is an interest in using caffeine for a number of other purposes, but there isn't enough reliable information to say whether it might be helpful. The side effect of the caffeine. When taken by mouth, caffeine is likely safe for most healthy adults when used in dozen up to 400 mg daily. This is equal to about 4 cups of coffee. Caffeine is possible unsafe when used for a long time or in doses over 400 mg daily. Caffeine can cause insomnia, nervousness, restlessness, nausea, increased heart rate, and other side effects. Larger doses might cause headache, anxiety, and chest pain. Caffeine is likely unsafe when used in very high doses. It can cause irregular heartbeat and even death. Products with very concentrated or pure caffeine have a high risk of being used in doses that are too high. Avoid using these products. Next, let us move on to the fourth quarter, which is also a substance use and abuse. What are the gateway drugs? Gateway drugs are introductory habit-forming substances that give way to more severe drugs used down the road. They are typically milder, fairly accessible substances, for example, alcohol or marijuana, that are first used in adolescence or young adulthood. These easy-to-get and easy-to-use drugs familiarize young users with first feelings of intoxication. Over time, it is thought that young users gain confidence and decide, hey, if I can handle this, what else can I try that will get me high? That's where the gateway effects comes in. Young users who try one drug are more likely to try more. Most often, the substances they take the second or the third time around are stronger, with more risky side effects. the prescription pills, or the cocaine. There is a science behind this. Drugs like marijuana and alcohol boost a user's dopamine levels, which therefore produces feelings of euphoria and pleasure. This is the high that first-time users experience. As they use more and more regularly, the user develops a tolerance and experiences less of the drug's effect. This may lead some to seek out different drugs that cause a more dramatic high, which is often where addiction begins. There was a question that is the gateway drug theory true? There is a ton of debate around whether gateway drugs actually exist. The truth is there are a lot of factors that can lead a person into drug use and addiction. It is not limited solely to prior use. Between 40 and 70% of a person's risk for developing a substance use disorder is genetic. However, one of the biggest contributors of addiction and one of the biggest players in the gateway drug theory is age. The age in which a person initiates drugs or drinking can tell a lot about his or her propensity for drug problems later in life. So, do gateway drugs exist in adolescence and young adulthood? Yes, they do. Every addictive drug is a gateway drug if used in this critical age window, while brain development is still underway. Now, let us proceed to the health curriculum guide of the grade 5. First quarter, the growth and development. First, what is puberty? Puberty is the time when a child moves through a series of significant, natural, and healthy changes. These physical, psychological, and emotional changes are a sign that a child is moving from childhood towards adulthood. Changes in puberty include the physical growth and development inside and outside of the children's bodies, changes to children's sexual organs, brain changes, and the social and emotional changes. When does puberty start? Puberty starts when changes in a child brain cause sex hormones to start being released from the gonads, which are the ovaries and testes. This typically happens around 10 to 11 years for girls and around 11 to 12 years for boys. But it's normal for the start of puberty to range from 8 to 13 years in girls and 9 to 14 years in boys. There's no way of knowing exactly when a child will start a puberty. Early changes in a child's brain and hormones level can be seen from the outside, so it's easy to think that puberty hasn't started. Puberty can be completed in about 18 months, or it can take up to 5 years. This range is also completely normal. For the girls, key physical changes in puberty. In girls, these are the main external physical changes in puberty that you can expect. Around 10 to 11 years, breasts will start developing. This is the first visible sign that puberty is starting. It's normal for the left and the right breast to grow at different speeds. It's also common for the breasts to be a bit tender as they develop. If a child wants a bra, a soft crop top or sports bra can be a good first choice. Second, a growth spurt occurs. Some parts of the body, like the head, face, and hands, might grow faster than limbs and torso. This might result in a child looking out of proportion for a while. On average, girls grow 5 to 20 centimeter. They usually stop growing at around 16 to 17 years. Next is the body shape will change. For example, a girl's hips will widen. Next, the external genitals or the vulva and hair will start to grow. The hair will get darker and thicker over time. For around 12 to 14 years, about 2 years after breast development starts, the hair will start growing under the arms. A clear or white discharge from the vagina starts several months before period starts. If the discharge bothers the child, you could suggest the child uses a panty liner. If the child says it's itchy, painful, or smelly, consult your doctor. Next is periods will usually start within 2 years of breast growth starting, but can take up to 4 years. For boys, the key physical changes in puberty. In boys, these are the main external physical changes in puberty that you can expect. Around 11 to 12 years, the external genitals will start to grow. It's normal for one testis to grow faster than the other. You can reassure the child that men's testes usually aren't the same size. Pubic hair will start to grow. It will get darker and thicker over time. Around 12 to 14 years, the child will have a growth spurt. A child will get taller and their chest and shoulders will get broader. Some parts of the body of the child, like their head, face, and hands, might grow faster than their limbs and torso. This might result that the child is looking out of proportion for a while. On average, boys grow 10 to 30 centimeters. They usually stop growing at around 18 to 20 years. It's common for boys to have a minor breast development. If the child is worried by this, it might help the child to know it's normal and usually goes away by itself. If it doesn't go away or if the breasts seem to be growing a lot, consult your doctor. Next is the personal hygiene. Personal hygiene can be described as the principle of maintaining cleanliness and grooming of the external body. It is looking after yourself and your body to maintain health. Personal hygiene is important for personal, social, psychological, and emotional reasons. It helps prevent infections and the spread of disease, illness, and body odor. Good personal hygiene can also have a positive impact of self-esteem, confidence, and body image. Personal hygiene is particularly important during the puberty as the body begins to produce more hormones that can increase the amount of sweat, oil, and odor of the body produces. The following things are essential to maintain optimum health. First is maintaining a well-balanced diet, drinking plenty of water, getting enough rest and relaxation, getting enough sleep, exercising regularly, avoiding alcohol and other drugs, and lastly, the maintaining appropriate personal hygiene. Next, for the grade 5, the second quarter is the safety and the first aid. Basic first aid treatment. Remember that when administer first aid treatment that involves contact with bodily fluids, it's important to wear protective gloves to eliminate the risk of disease transmission. For treatment of other injuries, gloves are optional. First is the minor wounds. Clean the injured area with soap and water and blot the wound dry. Avoid cleaning wounds with hydrogen peroxide or isopropyl alcohol as it can actually damage the tissue and delay healing. Once the wound is dry, apply antibiotic ointment and cover with gauze or a bandage. Next is the minor cuts and scrapes. First, stop the bleeding. If the cut or scrape does not stop bleeding on its own, apply pressure to the wound with a clean cloth or clean gauze while keeping the wound elevated. Clean the injury using soap and warm water, apply antibiotic ointment and bandage, and watch for sign of infection. Next is the bee and wasp stings. First, try to remove the stinger with tweezers or by scraping the stung area with a credit card. Then apply a cool compress to reduce swelling and remove tight clothing or accessories from the area in case swelling occurs. Watch for signs of shock or allergic reaction by checking the victim's airway, breathing, and circulation. If any of these are impeded, call the ambulance or the hospital immediately. Next is the burns. In order to ensure proper treatment, it's important to recognize the type of burn the victim has sustained. The first degree burn. The skin will appear red and may be painful or swollen. First degree burns generally do not require medical attention. Second degree burn. The skin will appear red, blistered, and swollen. This may require medical attention. Third degree burn. The skin will be visible, charred, and may turn white. Third degree burn are very painful and require medical attention. For first and second degree burns, submerge the affected area in cool water until the pain stops. If the affected area is too large to submerge, like the torso or face, cover it with cool, wet clothes. If blisters appear, do not break them. If no medical treatment is necessary, medicated first aid cream can be applied for pain. For third-degree burns or very serious second-degree burns, call the hospital or the ambulance. Do not try to move clothing stuck to the burn area, and do not apply compresses, creams, or gels for relief. Next is for the nosebleeds. The first thing to remember with nosebleeds is that even though they are scary, they are serious. It's important to stay calm, especially if the person with a nosebleed is a child, so as not to cause panic. To stop a nosebleed, keep the person upright with the head tilted slightly forward. Have the person pinch the lower half of their nose, the soft part, and hold it firmly for 10 minutes. After 10 minutes, if bleeding persists, repeat the exercise. Next is the splinters. To remove a splinter, first wash and dry the area to reduce the risk of infection. Then, using a magnifying glass, determine which way it entered the skin. Remove the splinter with sterilized tweezers, pulling it out in the same direction it went into the skin. Never try to squeeze out a splinter, as this could cause it to break into smaller pieces, making it harder to remove. Once the splinter is out, wash the area with soap and water again, applying a bandage if necessary. Next is the wrist and ankle sprains. Sprains happen when the ligaments in your ankle or wrist get stretched or torn. Most of the time, these are mild and can be treated at home. For wrist sprains, remember the acronym RICE, or the RICE. Rest, ice, compression, and elevation. Rest your wrist by using it as little as possible. Apply ice in 20 minutes increments. Wear an elastic compression wrap or bandage to help reduce swelling and keep your wrist elevated at or above the level of your heart. The at-home treatment for ankle sprains is similar. Remember the acronym MICE, or MICE: motion, ice, compression, and elevation. Motion may seem counterintuitive for a sprained ankle, but it's important to try slowly, flexing your foot upwards immediately after the sprint. Repeating this motion combined with ice compression and elevation can help reduce swelling and promote healing. Next is the heat exhaustion or heat stroke. When the body gets too hot, you may develop heat exhaustion, which can lead to heat stroke. Is a serious condition. Signs of the heat exhaustion include muscle cramps, excessive sweating, pale or cold skin, dizziness, and confusion. To treat heat exhaustion, move the person inside or into a shaded area. Have them lie down and elevate their legs to help blood reach their heart. Remove any type of clothing. Apply cool, damp towels to the skin and have them sip ice water or electrolyte drinks. If these treatments are not effective and the person develops a fever of over 102 Fahrenheit or has a seizure, call the ambulance or the hospital immediately. Next, let us move on to the third quarter, which is the substance use and abuse. First is the hallucinogens, also known as psychedelics, are a class of drugs that cause profound distortions in a person's perceptions of reality, otherwise known as hallucinations. While under the influence of hallucinogens, users might see images, hear sounds, or feel sensations that seem to be real but aren't. Hallucinogens can be man-made, or they can come from plants or mushrooms, or extracts from plants and mushrooms. Generally, they are divided into two types: classic hallucinogens, or the LSD, or the dissociative drugs, or the PCP. Either type of hallucinogen can cause users to have rapid, intense, and emotional swings. Next is what is marijuana? Marijuana is a dried leaves and flowers of cannabis, sativa or cannabis indica plant. Stronger forms of the drug include high potency strains known as sensimilla, high hash for short, and extracts. Of the more than 500 chemicals in marijuana, delta-9 tetrahydrocannabinol, known as THC, is responsible for many of the drug's psychotropic or the mind-altering effects. It's this chemical that distorts how the mind perceives the world. In other words, it's what makes a person high. The effects of hallucinogenic drugs. Hallucinogens can produce a range of effects that vary in terms of intensity, duration, and long-term effects. These drugs affect how people think, including their perception of reality and the self. The short-term effects are typically begin within 20 to 90 minutes of taking substances. These effects may be brief, lasting around 15 minutes in some cases. In other cases, these short-term effects may last as long as 12 hours. Common short-term effects include anxiety or panic, changes in appetite, changes in the perception of time, feeling of euphoria or relaxation, increased heart rate, intensified sensory experiences and emotions, nausea, paranoia, psychosis, and the sleep disturbances. Next is the long-term effects. Hallucinogens may also produce long-term effects in some cases. According to the National Institute on Drug Abuse, these effects are rare. Hallucinogen persisting perception disorder, or the HPPD, involves the recurrences of experiences associated with using the drug, including visual disturbances and hallucinations, such as flashbacks can occur suddenly with no warning and may occur more than a year following drug use. The persistent psychosis may occur in some cases. Symptoms include mood changes, paranoia, disorganized thinking, and visual disturbances. Next, let us move on to the fourth quarter of the grade 5, which is the community and environmental health. A healthy community is one in which local groups from all parts of the community work together to prevent disease and make a healthy living options accessible. Working at the community level to promote healthy living brings the greatest health benefits to the greatest number of people. What makes a happy community? In a happy community or in a happy, vibrant community, there are strong social connections that create a sense of belonging. With a strong sense of belonging and knowing other community members will take care of each other comes a sense of peace, security, and meaning. What are the examples of healthy communities? As such, a healthy community is one in which all residents have access to a quality education, safe and healthy homes, adequate employment, transportation, physical activity, and nutrition, in addition to quality health care. Unhealthy communities lead to chronic disease such as cancers, diabetes, and heart disease. What are the characteristics of unhealthy community? Poor quality housing, limited public transportation, high crime rates, and other socially disrupted conditions reduce sense of community, access to health care, and the ability to manage chronic diseases properly. So what are the 5 features of the community? If your community isn't as strong as you like, focus on developing these aspects. The strong communities usually exhibit these 5 features. The boundaries. The great online communities have boundaries, purpose, communication, history, and emotions. Let us move on to the health curriculum guide for grade 6. First, for the first quarter is the personal health, the emotional expression. Emotional expression is simply the acknowledgement of these emotions we are built to feel. Healthy expressions allows us to understand the emotions, truly feel them, and move on. What is the emotional expression? Our bodies are hardwired to feel emotions. Whether we express them or not, it is our choice. Feeling sadness, anger, or joy are natural responses to all the events our brains process every day. Throughout history, emotions have played a big role in human evolution. Going back millions of years, our brains develop emotions to pass along responses to certain events to help preserve the species. It's why seeing a predator naturally makes us feel fear. So, we know we need to run to save our lives. Emotional expression is simply the acknowledgement of this emotion we are built to feel, as I said earlier. Healthy expression allows us to understand the health emotions, truly feel them, and move on. There are 6 basic emotions humans are born with that we should all be able to recognize. The anger, sadness, fear, disgust, surprise, and the joy. We need to have awareness of these emotions as they happen. Awareness starts with understanding how they make us feel. It is also important to recognize situations that make them happen. This helps process emotions and let them go in healthy and productive way. For example, venting or dumping strong feelings isn't always helpful. It can actually cause more harm than we intend. Now let us proceed to the second quarter, which is also the personal health. First is the stress. Stress is a feeling of emotional or physical tension. It can come from any event or thought that makes you feel frustrated, angry, or nervous. Stress is your body's reaction to a challenge or demand. In short, burst stress can be positive, such as when it helps you avoid danger or meet a deadline. How to manage stress, or how to live with these 5 tips to feel less stress. First, use guided meditation. Meditation is a great way to distract yourself from the stress of day-to-day life. There are many guided meditations available on the internet that can help you find 5 minutes of centered relaxation. Second is the practice deep breathing. Deep breathing is a great way to reduce the activation of your sympathetic nervous system, which controls the body's response to a perceived threat. Deep breaths take into account of 5 seconds, held for 2 seconds, and released to a count of 5 seconds can help activate your parasympathetic nervous system, which helps reduce the overall stress and anxiety you may be experiencing. Third is the maintain physical exercise and good nutrition. Physical exercise and nutrition are 2 important components in how you respond to stress. When your body is healthy, your mind can be healthy and vice versa. Physical exercise is proven to be a great stress reliever and also help to improve your overall quality of life. Nutrition is important as stress can deplete certain vitamins such as A, B complex, C, and E. Maintaining proper nutrition not only helps your body feel better, but mind as well, which allows you to better combat stress. Fourth, they manage social media time. Spending time on social media sites can become stressful, not only by what we might see on them, but also because the time you are spending on social media might be best spent enjoying visiting with friends, being outside, enjoying the weather, or reading a great book. Fifth, or the last one, is to connect with others. Humans are social beings. You need to connections with people to feel supported. Finding a sense of community, whether at work, with a religious organization, or through shared activities such as organized sports, is important to your well-being. Enjoying a shared activity allows you to find support and foster relationships that can be supportive in difficult times. Next is for the third quarter of grade 6, which is the disease prevention and control. First, what is a communicable? Or what is communicable disease? A communicable disease is one that is able to be transmitted from one person to another. This can be via various ways such as body fluids or indirectly via vectors such as insects. Communicable disease in general cause fewer deaths worldwide compared with non-communicable disease. Some microbes such as bacteria as well as viruses can spread among people, causing communicable disease. The causes of communicable disease are often pathogens that may have originally been transmitted via vectors such as insects, which then spread to people. Often such illnesses are called zoonoses because animals carry the pathogen, which then inadvertently spreads to humans. Shortly after, human-to-human transmission occurs. Although communicable illness can be confused with non-communicable illness, it should be remembered that in communicable disease, genetics and lifestyle factors are not significant. Communicable disease can be prevented by improved hygiene practices and avoiding contact with ill individuals Vaccination also works well in some cases to prevent illness such as measles, mumps, and influenza. Good sanitary practices and a clean environment also help stop bacterial infection from occurring or spreading through a population. Now, what is non-communicable disease? A non-communicable disease is a disease that it is not spread to other people. The illness is usually not due to a virus or bacterial agent. This disease causes much mortality every year. In fact, in 2016, they caused an estimated 71% of deaths. Many non-communicable diseases are due to bad lifestyle choices people make, or in some instances can be result of a genetic mutation. Lifestyle in which people eat incorrectly and do not exercise often lead to metabolic syndrome that also then causes types of diabetes and cardiovascular disease. But conditions can be deadly, particularly if not diagnosed soon enough. Illness caused by genetic mutation includes cystic fibrosis and certain types of cancers. Although most often pathogens are not important in causing non-communicable diseases, there are many billing in a few cases between viruses and certain cancer. What are the prevention? It can be difficult to prevent non-communicable diseases that are inherited as genetic mutations. However, many other illnesses are due more to lifestyle factors such as bad eating habits and lack of exercise. Now let us proceed to the fourth quarter of grade 6 curriculum guide, which is the consumer health. What is health consumers? Health consumers are people who use health services as well as their family and careers. This includes people who have used a health service in the past or who could potentially use the service in the future. Who is a health consumer representative? A health consumer representative is a health consumer who has taken up a specific role to provide advice on behalf of consumers with the overall aim of improving health care. A consumer representative is often a consumer member of a committee, project, or event who voices consumer perspective and takes part in decision making on behalf of consumers. A health consumer representative may be nominated by and accountable to a consumer organization. Usually, the role is working with a health service or consumer organization and is often in a volunteer capacity. Sometimes, the role comes with a small payment to cover the consumer costs. That's all the health curriculum guide for grade 4 to 6. Now, teacher Ella Kunanan will discuss the health curriculum guide of grade 7 to 8. Back to you, teacher Ella.
So grade 7, Growth and Development, under sa first quarter. Sa content nito, andito yung holistic health, yung sa concept at dimensions nito. Next is the changes in health dimensions during puberty, yung sa physical, mental, emotional, at iba pa. Andito din ang management of health concern during puberty kung saan ka nagla-lack of, example sa exercise at sa tulog, ganon. Sa content standards nito, demonstrates understanding of holistic health and management of health concerns during puberty. Sa performance standards naman, appropriately manages concerns during puberty to achieve holistic health. Lastly, sa learning competency naman nito, discusses the concept of holistic health, wherein it explains the dimensions of holistic health in physical, mental, and emotional, spiritual, and etc. Next is grade 7, Nutrition. Sa second quarter po ito. Sa content, Right of the Child to Nutrition and Nutritional Guidelines kung saan dapat nilang matutunan yung sa food selection based on adolescents, nutritional needs, yung food pyramid at mga nutritional guidelines. Sa content standards naman, sinasabi dito na demonstrates understanding of nutrition for a healthy life. At yung sa performance standards naman nito, the learner makes informed decisions in the choice of food to eat. Under its learning competency, explains the right of the child to nutrition, follows the guidelines, explains the need to select food based on the nutritional needs during puberty, and many more. Sa grade 7, Disease Prevention and Control, third quarter, its content is the chain of infection, factors that influence the health equilibrium like host, agent, and environment, and others. In content standards, demonstrates understanding of the ways to prevent and control communicable diseases. In performance standards, consistently demonstrates helpful practices in order to prevent and control communicable diseases. In its learning competency, analyzes the common beliefs about disease causation, discusses the factors that affect disease transmission, and control the spread of communicable diseases and others. Grade 7 Community and Environmental Health under fourth quarter, its content, community and environmental health issues and their impact on people's health, pollution, pests and rodents, and etc. Sa content standards naman, demonstrates understanding of environmental health to attain community wellness. In performance standards, consistently demonstrates helpful practices to prevent and control common community and environmental health problems. In its learning competency, critically analyzes the impact of community and environmental issues and problems on people's health. Another is to conduct a survey of the pressing environmental problems in the community in water supply, food supply, disease control, health and medical care, and a lot more. Next is yung sa grade 8, Family Health under first quarter, Gender and Human Sexuality, wherein the dimensions of human sexuality, the factors affecting attitudes and practices on sexuality, and importance of sexuality for family health will be discussed. Another is the issues and problems in sexuality. In content standards, demonstrates understanding for human sexuality to achieve a healthy personality. Next is the performance standard, appropriately manages sexuality-related issues through responsible and informed decisions. Under its learning competencies, discusses sexuality as an important component of one's personality, wherein it explains the dimensions of human sexuality, analyzes the factors that affect one's attitudes and practices related to sexuality, assesses personal health attitudes that may influence sexual behavior, and relates the importance of sexuality to family health. Another is it discusses the signs, symptoms, and effects of STIs or sexually transmitted infections. Next is grade 8 Disease Prevention and Control under second quarter. Content is nature, prevention, and control of common communicable diseases and the emerging and re-emerging diseases, and etc. Content standards demonstrates understanding of communicable disease, prevention, and control. In performance standards, consistently demonstrates personal responsibility and helpful practices in the prevention and control of communicable diseases. In learning competencies, discusses the nature, prevention, and control of common communicable diseases and analyzes the nature of emerging and re-emerging diseases such as SARS or the influenza AH1N1 and etc. Grade 8 Personal Health, third quarter. Content is mental and emotional health, such as the characteristic of a mental and emotionally healthy individual and factors that affect the promotion of good mental and emotional health. Content standard demonstrates understanding of mental and emotional health as a component of holistic health. In performance standard consistently demonstrate skills that promote mental and emotional health. Learning competency describes a mentally and emotionally healthy individual, explains the factors that affect the promotion of good mental and emotional health, and many more. Grade 8 Safety and First Aid for the fourth quarter. Content is concept of intentional injuries with its nature and types. Data on intentional injuries. Another is risk and protective factors in intentional injuries and prevention and control of intentional injuries. Content standard demonstrates understanding of the concepts and principles of safety education in the prevention of intentional injuries. Performance standard consistently demonstrate resilience, vigilance, and proactive behavior to prevent intentional injuries. Learning competencies demonstrates ways to prevent and control intentional injuries like preventing self-harm and seeking help from trusted individuals and health professionals. Another is discusses the concept of intentional injuries wherein it differentiates intentional from unintentional injuries and etc.
Now I'm back. I'm Nikki Mea again for your reporter for the Health Curriculum Guide for the Grade 9. First quarter is the Safety and First Aid. What are the 3 P's of First Aid? First is preserve life. As a first responder to any situation, your first priority should be to preserve life. You may need to perform CPR, stop bleeding, or take other action to preserve the victim's life. Start with CAB circulation, airway, and breathing. Assess the quality of the victim's circulation. Adjust if needed. Ensure that the victim has no blocks to their airway and that they are breathing. The goal is to prevent the condition from worsening in any way. Second is to prevent deterioration. Do what you keep the victim in a stable condition until medical professionals arrive. The goal is to prevent the condition from worsening and prevent any potential further injury. This may mean moving the victim to a safer location, applying first aid, stabilizing them, or just staying with the victim and providing comfort. Third is to promote recovery. After you've done what you can do with the first aid treatment, your job now is to promote recovery. This can be done by encouraging confidence, providing comfort, attempting to relieve pain, and so on. These tips and tricks for emergency situations and first aid will likely differ based on your specific situation. But remember, the basics of what to do may help you save a life or prevent further pain. Know these simple steps before you find yourself in a situation where it's hard to think clearly. Next, for the first aid is the bandaging. Covering a break in the skin helps to control bleeding and protect against infection. Dressings are pads of gauze or cloth that can be placed directly against the wound to absorb blood and other fluids. Cloth bandages cover the dressings and hold them in a place. Step 1. Dress the wound. Put on gloves or use other protection to avoid contact with the victim's blood. Clean the wound with mild soap and water. Apply a small layer of topical antibiotic if desired. Place a clean dressing over the entire wound. Gauze dressings let in the air for faster healing. Non-stick dressings have a special surface that won't cling to the wound. If blood soaks through the dressing, place another dressing over the first one. Step 2. Cover the bandage. Wrap roller gauze or cloth strips over the dressing and around the wound several times. Extend the bandage at least in an inch beyond both sides of the dressing. Don't wrap the bandage so tight that it interferes with blood flow to healthy tissue. Step 3. Secure the bandage. Tie or tape the bandage in place. Don't secure the bandage so tight that fingers or toes become pale or blue. The last step is the check circulation. Check circulation in the area below the bandage after several minutes and again after several hours. If circulation is poor, the skin may look pale or blue or feel cold. Signs of poor circulation also include numbness and tingling. If circulation is reduced, loosen the bandage immediately. If symptoms continue, seek medical attention. Next, for the second quarter of grade 9 is the substance use and abuse. So, this is the curriculum guide, health curriculum guide of the second quarter. On July 1, 2016, the Philippines implemented a national drug policy termed Project Tokhang with the aim of eradicating the nation's drug problem. This policy involved the Philippine National Police conducting house visitations of drug suspects to persuade them to surrender and agree to cease their drug misuse. So, yung iba is ginawang dahilan yung Plan Tokhang upang patayin yung mga ibang tao kahit na hindi sila hindi drug users. Sinasabi pa rin nila na drug users sila. So, let us move on to the third quarter, which is the consumer health. The top 10 most common health issues are physical activity and nutrition, overweight and obesity. Third is tobacco. Fourth, substance abuse. Fifth, HIV or AIDS. Sixth, mental health. Seventh, injury and violence. 8. Environmental quality. 9. Immunization. And 10. Access to healthcare. First is the physical activity and nutrition. Research indicates that staying physically active can help prevent or delay certain diseases, including some cancers, heart disease, and diabetes, and also relieve depression and improve mood. Inactivity often accompanies advancing age, but it doesn't have to. Check with your local churches, senior centers, and shopping malls for exercise and walking programs. Like exercise, your eating habits are often not good if you live and eat alone. It's important for successful aging to eat foods rich in nutrients and avoid the empty calories in candy and sweets. Next is the overweight and obesity. Being overweight or obese increases your chances of dying from hypertension, type 2 diabetes, coronary heart disease, stroke, gallbladder disease, osteoarthritis, sleep apnea, respiratory problems, and endometrial, breast, prostate, and colon cancer. In-depth guides and practical advice about obesity are available for the National Heart, Lung, and Blood Institute of the National Institutes of Health. So, pwede kayo mag-search doon. Next one is tobacco. Tobacco is the single greatest preventable cause of illness and premature death in the U.S. Tobacco use is now called tobacco dependence disease. The Centers of Disease Control and Prevention, or the CDC, says that smokers who try to quit are more successful when they have the support of their physician. Next one is the substance abuse. Substance abuse usually means drugs and alcohol. These are two areas we don't often associate with seniors, but seniors like young People may self-medicate using legal and illegal drugs and alcohol, which can lead to serious health consequences. In addition, seniors may deliberately or unknowingly mix medications and use of alcohol. Because of our stereotypes about senior citizens, many medical people fail to ask seniors about possible substance abuse. Next is the HIV or the AIDS. Between 11 and 15% of AIDS cases occur in seniors over age 50. Between 1991 and 1996, AIDS in adults over 50 rose more than twice as fast as in younger adults. Seniors are unlikely to use condoms, have immune systems that naturally weaken with their age, and HIV symptoms like fatigue, weight loss, dementia, skin rashes, swollen lymph nodes are similar to symptoms that can accompany old age. Again, stereotypes about aging in terms of sexual activity and drug use keep this problem largely unrecognized. That's why seniors are not well represented in research, clinically drug trials, prevention programs, and efforts at intervention. Next is the mental health. Dementia is not part of aging. Dementia can be caused by disease, reaction to medications, vision and hearing problems, infection, nutritional imbalances, diabetes, and renal failure. There are many forms of dementia, including the Alzheimer's disease, and some can be temporary. With accurate diagnosis comes management and help. The most common late in life mental health condition is depression. If left untreated, depression in the elderly can lead to suicide. Here's a surprising fact. The rate of suicide is higher for elderly white men than for any other age group, including adolescents. Next one is the injury and violence. Among seniors, falls are the leading cause of injuries. Hospital admissions for trauma and deaths due to injury. 1 in every 3 seniors aged 65 and older will fall each other. Strategies to reduce injury include exercise to improve balance and strength and medication review. The home security can help reduce injury. Home security is needed to prevent intrusion. Home-based fire prevention devices should be in place and easy to use. People aged 65 and older are twice as likely to die in home fire as the general population. Next is the environmental quality. Even though pollution affects all of us, government studies have indicated that low-income, racial, and ethnic minorities are more likely to live in areas where they face environmental risk. Compared to the general population, a higher proportion of elderly are living just over the poverty threshold. Next is immunization. Influenza and pneumonia are among the top 10 causes of death for older adults. Emphasis on influenza vaccination for seniors has helped. Pneumonia remains one of the most serious infections, especially among women and the very old. Next, for the fourth quarter of the grade 9, the consumer health again. So this is the health curriculum guide for the grade 9 fourth quarter. Why do we need to evaluate health products? They evaluate whether one product might better suit their health needs and justify their decision. They might also identify other actions that can be taken to ensure that their conclusion is the most satisfactory one. So what is the basic policy of the RA 7394? Declaration of policy: the state shall ensure safe and good quality of food, drugs, cosmetics, and devices, and regulate their products, sale, distribution, and advertisement to protect the health of the consumer. And other laws that focuses on the policies of the consumer. Now, let us proceed to the grade 10, the grade 10 health curriculum guide. For the first quarter, we have the safety and first aid. So, what is unintentional injuries? Unintentional injuries refer to injuries that are unplanned and typically preventable when proper safety precautions are followed. The Center of Disease Control and Prevention, or the CDC, defines unintentional injury as the physical damage that results when a human body is. What are the top 5 unintentional injuries? The most common unintentional injuries result the motor vehicle crashes, falls, fires and burns, drowning, poisoning, and aspirations. Now let us move on to the second quarter, which is the family health. What is family health? Family health is a state in which the family is resource for the day-to-day living and health of its members. A family provides its individual members with key resources and healthful living, including food, clothing, shelter, and sense of self-worth, and access to medical care. So, dito din yung courtship, kung paano manligaw yung mga lalaki sa mga babae, then dating, and marriage. So, dito din yung pregnancy-related concerns and prenatal care, kung paano natin gagawin or what is the tamang health care of the pregnant for woman. Then, nandito rin yung responsible of the parenthood, kung ano yung mga dapat gawin ng magulang para maging maayos at maging masaya ang isang family. So, may dadagdag lang ako, what is the difference between home and house? So, yung house, this is the building. Ito lang yung kung saan titira yung mga family members ng isang family. Then, a home is the what you care about your family or love about your family. Then next is the third quarter of the grade 10, which is the health trends, issues, and concerns. So right now, yung health issues or concerns natin ngayon is the global warming. So yung mga scientists sa ibang bansa ay dinakip ng mga police regarding sa pagrally nila about the climate change. Climate scientist Peter Kalmus and 3 other scientists were arrested at JP Morgan Chase, the world's largest investor in fossil fuels. So, he said that we need 1 billion climate activists. I encourage everyone to consider where we are heading as a species and to engage in civil disobedience and other action. The time is now. We've waited far too long. Mobilize, and mobilize. Mobilize before we lose everything. So sabi ko nga kanina is hinuli sila ng mga pulis. So, yung mga other country or the kabataan is gumagawa sila ng solusyon or para makatulong upang hindi masyadong masira yung environment natin. So, yung mga iba is nag-download ng Ecosia, which when you search some information, you plant more trees by using the Ecosia long term. So now we need to save the earth. According to them, we have only 4 to 5 years. So let the earth breathe. Simply by performing the following, you may help and conserve the environment. Ways to help the environment: delete unwanted emails, save electricity, save water, drive less, plant more trees, avoid smoking, unplug electrons you don't use electric fan instead of aircon, use LED lights, and spread awareness to your family and friends. In purchasing energy-efficient appliances such as light, air conditioners, heaters, refrigerators, and washing washing machines. When you are not using something, turn it off. This includes light, television, video games, and other electrical equipments. Don't burn plastic and don't cut too many trees so that we can continue to breathe pure air. Next is delete unnecessary and unwanted emails. Why? Deleting emails is the easiest way to reduce your carbon footprint on the computer. What is carbon footprint? Footprint is the total greenhouse gas emissions caused by an individual, event, organization, service, place, or product expressed as carbon dioxide equivalent. Lastly, the fourth quarter of the grade 10, which is the health trends, issues, and concerns again. So what is personal health? Personal health is Personal wellness plans are exactly what they sound like. They're personalized plans to help you maintain health and well-being. Talking to a doctor about your plan will help you get the most accurate assessment. Health education promotes a healthy lifestyle and raises awareness about the importance of health. This can be done when professionals take part in educating people on what they can do to have a healthier life. That's all for the K-12 Health Curriculum Guide for the grade 1 to the grade 10. So what is the importance of the curriculum guide? Teachers know that a curriculum guide is the most important document available to them, and without one, it will be difficult to write lesson plans. Using a curriculum guide, teachers create effective lesson plans that are based on the state goals and objective of what is intended that the students may learn. It enables the learners to acquire essential knowledge, attitude, and skills that are necessary to promote good nutrition, to prevent and control diseases, to prevent substance misuse and abuse, to reduce health-related risk behaviors, to prevent and control injuries with the end view of maintaining and improving the skills of the students. So yung curriculum guide natin from 1 to 10 is for simple to complex, para mas lalong maintindihan ng mga bata. Hindi yung grade 1 pa lang is complex na yung mga lessons na tinuturo ng teachers. So, dapat kailangan maiakma natin yung mga lessons or the topics for the students. That's end for my report. Thank you for listening.
Good morning, sir. Good morning, classmate. I'm Christine Vedan from BEd 3E. Let's now begin with the lesson. Let's talk about the injury prevention, safety, and first aid. Injury prevention, safety, and first aid causes cost and prevention of accidents and injuries at home, in the school, and in the community, and in the performance of different activities through promotion of safety environments, safety programs, procedures, and services, including first aid education. The basic necessities of mankind include food, clothing, and shelter. However, it's not enough that we have these basic needs. If we are living in the fear and the uncertainty of danger every day. Today, one rising necessities that we need to focus on is safety. We are always exposed to dangers, whether we are young or old, rich or poor. It is therefore necessary that we are aware of what these possible dangers are, how all of this can affect us, and how we can prepare ourselves to prevent them from happening or minimize their effect. If they happen to us, there is a very popular saying, prevention is better than cure. Practicing this principle advocates safety awareness, which is essential is in achieving quality of life. Accident may happen to anybody at any place at any time. Thus, taking the right safety measure greatly helps prevent accidents and injuries. Nevertheless, when accidents happen, it is important to have knowledge and skill to deal with them. Having knowledge and skills on a safety education and injury prevention could help you, your loved ones, and other people in your community during emergency situation. Nutrition. Recognition of the nutrients children and adolescents need, analysis of the quality and quantity of their food intake, and development of proper eating habits to meet physiological and psychological and social needs, including diseases and disorders that arise from improper eating habits. Nutrition is defined as all processes used by a child to take in food and digest, eat, absorb, transport, utilize, and excrete. Food substances. The food substances found in food are called nutrients. Eating food is a very important component of life. Eating proper food that ensure good nutrients increase a child's energy growth and development. Normal behavior resistant to illness and infection and tissue repair. The intake of nutrients affect the behavior of children. A child who is well nourished is usually more alert and attentive and has better physical and learning experiences. The way a child responds to resistance of illness. Proper nutrition plays an important part. Well-nourished children are less likely become ill, and when they are ill, recover is quicker. Personal health. Develop and daily practice of health behaviors that promote physical, mental, social, emotional, and moral spiritual health, and prevention and management of personal health problems. Personal health. Some preventive health care practice that people can take are avoidance of smoke and substance abuse such as drug and alcohol. Eat a healthy diet, low in fat, exercise routinely, brush teeth regularly and frequently, washing your hands, instilling a healthy habits and practices that in children can help prevent accident due to lack of proper nutrition, all the way to making sure they wear a safety helmet when riding their bicycle. It has been documented by the World Health Organization that health is a state or quality of total physical, mental, and social being. Prevention and control is a very important health concern because it affects the quality of people's life. Communicable disease that only treated the sick person but also his or her family and the society in general. Thus, protecting ourselves and our families from disease is both a personal and social responsibility. As you go along, you will notice that the disease you are experiencing or encountering can be prevented if you only know how to control them accordingly. If you lack self-discipline, then prevention and control of disease will be difficult to attain. Right-based. Further, the realization of human rights as laid down in the Universal Declaration of Human Rights and other international human rights instruments. Right holders are intentionally recognized legal frameworks that agree all people are born free and have a set of rights, called human rights. They apply regardless of ethnic origin, skin color, sex, language, religion, sexual identity, or political opinion. When forum states work for this right to be fulfilled is called the human right-based approach and is based on the UN framework from human rights. To fully understand the human right-based approach, we need to look at the two parties involved. On one side, we have the individual. This person is born free with a set of human rights. We call the individual a rights holder. On the other side, we have the state responsible to protect and fulfill this freedom and human right. It's a legal obligation that the state takes on when signing international human rights agreements. We call the state of duty payer. The fundamental mission of the state is to create the prerequisite needed so that the people have access to their rights. This is done by ensuring that no one is discriminated against. For example, by establishing the same opportunities for boys and girls to attend school. According to human rights agreements, the duty payer, namely the state, has an obligation to fulfill the right of the right holders. In return, the right holder has a claim on the state to pursue its mission in a democracy. One could say that the government has been hired by its citizens to meet the state obligations. Everyone also has a personal responsibility not to discriminate or offend anyone in their surrounding from a human rights perspective. We must also respect one another. At the same time, we know that the value, norms, and sometimes even the national law can contradict international human rights agreement. In these cases, the state always bears the ultimate responsibility for changing attitudes, cultural expression, and tradition that are inconsistent with Human Rights Convention, which is a signed forum seat. Work is about strengthening the rights ability to demand accountability for change in cases where rights are being violated. The human right-based approach is those about change. Having a human right-based approach means making contradiction visible by analyzing inequalities. We identify who has power over whom in the community or certain context to understand how and when people's freedom to decide over their lives become limited. Sometimes the human right-based approach is about demanding accountability from the state, and sometimes it is about educating authorities at different levels. It is also about changing values, attitude, and opportunities for people so that the power and resources are distributed in an equal, sustainable manner. To this is increasing gender equality and sustainable use of natural resources. Standards and outcome-based require students to demonstrate that they have learned the academic standards set on required skills and content. Outcome-based education, we start with its meaning. What actually is OBE? OBE, or outcome-based education, is also known as standards-based education. This is a theory that is centered on outcomes or goals, which mean that we are shifting our focus. We are no longer focused on trying to finish everything that we need to finish for the entire school year. Instead, our focus is that our students should reach the goals or the outcomes that we have set for them. Substance use and abuse, the prevention and control of the use and abuse of substances, their identification, causes and effect on the person, the family, society, and the nation. Misuses of substances like alcohol and drug is a growing problem in the US, and teens and young adults are most at risk, with half of all new drug users being under the age of 18 and 1 in 5 high school students having abused prescription drug. Additionally, 1/3 of high school students currently use alcohol, 23% use marijuana, and 22% use all forms of tobacco combined. Decision-making in teens involve a chemical called dopamine in the brain's reward center. Dopamine helps transmit signals in the brain that make people feel happy. The number of brain receptors interacting with dopamine is higher in adolescence than at any other time of life. That means that when a teen is exposed to a reward, such as a compliment, the reward center reacts more strongly than it would for an adult. Also, being with friends increase the sensitivity to rewards and makes the already sensitive reward system even more sensitive, feeling reward more strongly and responding more intensely to what peers may think, means that there are biological reasons for why teens sometimes decide to do things with their friends that they would never do on their own. This can be positive by encouraging friends to take on new challenges, but it can also lead to dangerous decisions. Values-based promotes an educational philosophy based on valuing self, others, and environment through the consideration of ethical values as the base of good educational practice. The professional values will help you to apply the new knowledge and behavior standards to all those different situations and to make decisions that benefit people as well. As the business, the professional values are principle-led, evidence-based, and outcomes-driven. Being principle-led means considering what you stand for as a people professional when you're making those decisions. So even when there's no obvious rule or precedent, you still have a clear purpose to guide you. That's all. Thank you for watching.
So, I am Evelyn P. Ekotanim. Now, we're going to discuss the code book legend in curriculum. So, what is code codebook. So, codebook describes the contents, structures, and layout of the data collection. So, a well-documented codebook contains information intended to be complete and self-explanatory for each variable and data file. So, ano nga ba ang learning code or book legend or yung gamit nito sa curriculum guide? So, dahil dito is naka-generalize ang objective o learning competencies, kaya't naman naglalagay ng learning code ang DepEd upang madecongest ang nasabing objectives or mas maging specific ang objectives o learning competencies. So, dito, hahatiin mo ngayon ang content or yung mga topics. So, sa isang learning competencies na ito is mas mapapadali or mas mapapabilis natin yung mga ang mga guro and at the same time pati yung mga estudyante. Kasi mas madali nilang ma-identify yung mga subject kung pang ilang weeks or pang ilang days, gano'n, yung mga lesson nila. So, dito is parang sa word pa lang na code. Code is malalaman na natin kung ano nga ba ang gustong iparating nito, kung ano nga ba ang nakapaloob dito. So, di ba, halimbawa na lang ngayon, di ba? Dahil online class tayo, or especially to sa mga elementary, mas madalas nating or nilang nakikita ito sa mga modules nila na sinesend ng mga teachers. Dahil dito is mas ginagamit nila para sa title. Kasi title ng kanilang modules para mas mapadali or mas mapabilis na ma-recognize ng estudyante kung anong subject, kung pang ilang activities, at the same time pang ilang weeks yung mga ginagawa nila. So, di ba, marami tayong nakikita ng mga code na ganyan, pero di man natin alam kung anong tawag doon o kaya naman kung para saan ba talaga yung mga code na ito. So, ito ay isang pinaka-importante dahil sa pamamagitan dito is mas napapadali yung mga estudyante na maghanap ng mga modules at hindi na din sila nai-stress sa sobrang dami ng tinuturo ng mga teachers. So, dito is parang mas pinagdali nila yung mga trabaho. Ayun lang yung sa code of legend.